So I would like to welcome you this morning. I'm Sarah Scranton. I'm the Executive Director for Planned Parenthood Affiliates of Michigan, and I have two wonderful guests with me today, Senator Martha Scott and Jim Richardson, who is the CEO of one of our Planned Parenthood health centers, Planned Parenthood of East Central Michigan.
Good morning.
Good morning. So welcome to all of you and good morning. Today, Planned Parenthood Affiliates of Michigan joins our colleagues around the country and in Washington, D.C. to announce a very exciting initiative. We're here to call upon our legislators to put politics aside once and for all and support common sense prevention policies through the Prevention First campaign. The Prevention First campaign symbolizes our commitment to support healthy families through common sense prevention measures. Improving access to preventative health care, supporting healthy families should be a shared statewide goal that we all can agree upon. If we are committed to reducing unintended pregnancies in Michigan, we must get to the root of the problem through prevention. We must ensure reliable sexual and reproductive health education and information. We must increase access to family planning services and help plan parenthood. As the nation's leading advocate and provider for reproductive health services, Planned Parenthood knows that providing individuals with information and education, that means real sex education and access to birth control that is affordable, those are the best tools that we have to preventing unintended pregnancy and therefore the need for abortion. Our Prevention First campaign is a family planning initiative that expands access to prevention and healthcare services and education programs to help reduce unintended pregnancy, reduce sexually transmitted infections, and support healthy families by improving women's health, all while saving scarce public health dollars. Our Prevention First campaign focuses on 5 main areas. Those are increased access to family planning services. We will strive to ensure access to health care for low-income families. We will ensure equity in prescription insurance and contraceptive coverage. We will reduce the risk of unintended pregnancies by improving awareness of emergency contraception. And finally, we will strive to protect our teens through comprehensive, medically accurate abstinence plus education. By promoting these prevention-based common sense policy, we know that we can reduce the unintended pregnancies in Michigan and make this a Michigan that all of us agree and like and can live with. So I'm going to turn it over to Senator Scott now to talk about one of the goals of our Prevention First campaign, which is to ensure equity in prescription insurance and contraceptive coverage. Senator Scott?
Good morning. Thank you so much, Sarah. I am certainly thrilled to be here this morning, and I'd just like to thank Parenthood for allowing me to join them in this press conference this morning. It's important for us to continue educating and making people aware of this important issue, contraceptive equity. I have reintroduced Senate Bill 41, and we was happy to have my colleague, Senator Gilder Jacobs, introduce Senate Bill 42, legislation that seeks to expand prescription coverage to include certain contraceptives. Women pay more out-of-pocket health care costs than men, up to 20% of their income compared to men who spend merely 12%. This two-bill package would require insurance plans that cover prescription drugs to cover prescription birth control methods in the same manner in which all other drugs are and procedures. Passage of this legislation would increase access to safe, reliable birth control to thousands of women. 22 states already have passed similar legislation. I remain hopeful that this will eliminate the health care disparities here in Michigan and get this important package through the legislature process and to the governor's desk for her signature. And again, I thank all of you for being here.
Thank you, Senator Scott. I'd now like to turn it over to Jim Richardson to talk about the core of what Planned Parenthood does and part of our prevention
Well, Senator Scott, thank you very much for introducing this very important legislation. And on behalf of Planned Parenthood, particularly the many families in and around Flint area and up into Saginaw, it's extremely important. And I know for your constituents down in the Detroit area, it's really vitally important. In these hard economic times that we really know how important this is. I'm glad that you pointed out the disparity of what women have to pay in order for their health care. The importance, very important part of basic health care is contraception and access to contraception and the other important aspects of what we do around screening for sexually transmitted diseases, for providing kind of basic screening, health screening for it. So I'm just delighted that you're introducing this piece of legislation as part of a total package of legislation that we need about bringing prevention services to the women and men of the state. I'm from Flint, Michigan, and Flint has experienced a serious economic downturn. More women than ever, more families than ever, are in need of good basic health care, access to preventative health care. And these series of bills will enable those women and families who have had difficulty finding access to the health care to be able to get it. If we're able to do these services and get these bills passed, and we can get prevention programs in place, we're going to do a lot to improve the health of women and families within Genesee County and within the service areas that we have. So when we look at the need that's in the state, we're right now meeting about half the need. There's about 500,000 women in need of family planning, reproductive health care services. We're serving about half those. And these kinds of bills and an effort for prevention is an important economic investment into the community. Because if we are able, if the state and other programs are able to invest in health care, it will improve the health care of women and prevent unintended pregnancies and help us improve the health care. So, I'm just delighted that we're going to be able to do that. Thank you very much.
I'm delighted that you're here with us.
Thank you very much. Yes, indeed.
In closing, I'd just like to thank all of you for coming. I'd like to thank Senator Scott and Jim for being here to talk about the important components of our Prevention First campaign. We will now go to really call upon our legislators. We'll be dropping off information about this campaign to all of the Michigan legislators today, and we'll also be asking them to sign our Prevention First Challenge for Common Ground, saying that they do in fact support prevention-based policy